80% of people or 85% will have low back pain in their life. Only 27 to 35% of the time is it disc related. When one of those discs, actually, this is one of them, dislodged itself, but when the disc that sits above and below these two levels pushes outward or herniates, it could push on any one of these nerves that's traveling downward. Anytime you get any touching of this nerve with some other structure, in this case the disc, you get the radiating symptoms that go down whatever dermatome this is. What that means is this nerve will feed some function of the lower body or some sensory area of the lower body. Depending upon where people complain of pain, like, "Oh, I feel it in my hip," or "I feel it in my leg around my knee," or "I feel it down behind my knee down to my foot." You pretty much know what level of disc problem they have because it's representative of the level of herniation. When you press on something that is at the level of, like, L5-S1, right, the last lumbar vertebrae and the first sacral vertebrae, it's gonna give you symptoms like numbness, tingling down near the back of your calf, underneath your foot. If you get something more around the hip, and a lot of times people complain of hip pain. They think they have a hip issue. It's actually a back issue that's pressing on a nerve that wraps around that area. So that's an L2, L3, or L3, L4. You get indicators of where that's coming from.